This is Faith Campbell. This is my video patho for my snake bite patient in Eswatini. The patient is a 45-year-old female. She reported having the snake bite at 6 p.m. on the day before she was admitted. The next day, she called a hospital and spoke to a physician, and she told him that she had put a tourniquet above the snake bite wound. He told her to take it off because he wanted to get good blood flow going to the wound. The patient came in the next day. She received multiple vials of the antivenom. And then on about day 3 of her admission, she developed a blister on the site, and they popped the blister open and it was filled with pus. And so they debrided the area as much as they could, and they performed proper wound care and gave it a new dressing. And they put in wound care orders to be done every 3 days to just have proper cleanliness and to prevent any further infection. Next, on to risk factors, physical assessment, and diagnosis. Possible risk factors that put the patient at risk for getting a snake bite. It is not so much of a pathophysiology because this is an injury that the patient received, but just from hearing the story about how she got it, she said that she got it while she was on her farm. And so just thinking about where that is in nature, it could put her at a predisposition for receiving a snake bite. And also just in the area that we were in, snake bites were really common because of the way that the people lived and the type of housing that they were in. And so that would also put the patient at having a risk factor for getting the snake bite. As far as the physical assessment, the patient didn't really present with any other abnormals besides the localized abnormality on her right lower leg. Her heart sounds were regular, S1 and S2 were heard. Her pulses were good. Even her pedal pulse on her right leg was still palpable. It was just slightly diminished. Her respirations were regular. They did report that she had a slightly higher respiratory rate twice on the day that we were assessing her, but it was only 21. As far as bowel sounds, they were normal. They were active in all quadrants. She was able to use the restroom, and she did have bowel movements. Musculoskeletal wise, she was able to move all of her extremities. She obviously had decreased movement in the limb with the snake bite, but she was still able to move around and had a mobility in the foot as well. And tegumentary, she had the localized abnormality. That morning that we had her as our patient, she did have the blister on the snake wound. They debrided it, and so now it has the clean dressing on it. It still has some redness and tenderness around the area, but we weren't able to undress it again because they try to keep it closed off from the air. For neuro, she was alert and oriented times 4, and she had full cognitive ability. Perlo was present, and all of her other vitals were within normal limits. Some diagnostics that were more pertinent, they don't do a full CBC, but she received, she got her white blood cell count and her platelet count done as well. Alrighty, as far as pertinent vital signs, labs, and medications, the white blood cell count that was taken was elevated at 17, with normal being 4.5 to 11. This was most likely due to the snake bite itself, caused local inflammation at the site, not to mention the systemic inflammation and effects that could have happened from the venom in the snake. They did not know what kind of snake bit her though. And then, since we know that the snake bite was infected by the blister with the pus in it, this would also point to her having an elevated white blood cell count because her body is trying to fight off that infection. Her platelet count was also decreased. It was at 149, with normal being 165 to 450. There could be many possible reasons that this is low. A more superficial reason would be just because she suffered an injury to her limb. But the more that I looked into snake bites, it said that the systemic response of having the venom into the bloodstream and into the lymph could be that it causes coagulopathy issues and actually hemolysis of the red blood cells, and so that would decrease the platelet counts. As far as pertinent medications, the patient is on amoxicillin for treatment of prophylaxis for any bacteria. She's also on metronidazole, and I think that this was added to her medication regimen, especially after the blister formed on top of the snake bite. But she's on both of these one tab daily of 500 milligrams. She also has paracetamol, which is Tylenol, as PRN, and they're kind of giving it to her regularly to decrease inflammation and also just control pain so that she can keep that range of motion at the site. And they did not say they were giving her any more antivenom vials, but they said that they had given her multiple vials since she had been there. Next, for what I would say is the most pertinent nursing diagnosis, is the fact that there is an infection in the snakebite wound. There's an actual presentation of this supported by the cues of the blister that formed on top of the snakebite, and it was containing pus. Also, her increased white blood cell count, that was 17, signaling that there is inflammation and infection present. And her periodic increased respiratory rate could be contributed to the infection. And her overall malaise is just not feeling well. Treatment for this, they debrided the wound, they drained the blister, and they also cleaned the area and did proper wound care, which I think is one of the most important things. And they are giving her metronidazole and amoxicillin to treat the infection. And they are also have her prescribed paracetamol, which is their Tylenol, to decrease inflammation and treat any pain at the site. Goals for this patient that I would have is just promoting steady wound healing of the snake bite and to relieve any pain or discomfort. I'd say just sticking to the medication regimen and promoting a really clean space, always sticking to proper wound care, doing it when the orders are there, using the betadine and the ointment that were ordered in the wound care, and also just keeping the space around her clean, the sheets and everything like that. Interventions that I would say for this patient is promoting comfortable positioning. They keep their snakebite patients there for so long, and so I think just making sure that she's comfortable, also turning and making sure that she's not laying on one side for too long, because we don't want her to develop any pressure wounds. I think it would also be a great idea, because it was her lower limb that was infected. She's not able to walk like she used to, and so I think giving her range of motion exercises and things to do so that she doesn't lose mobility would be a priority. And then administering her antibiotics to heal the infection and practicing the proper wound care and cleanliness are also priorities so that we can keep that area clean and promote good healing. For post-shift evaluation, I think that the patient is definitely progressing towards healing. She's already progressed a lot, and they have treated the infection very promptly. And so I think with continuous wound care, doing it when it's ordered, doing it properly, and educating the patient about keeping the area clean, having good range of motion, making sure we're getting good blood supply to that limb. She's still in the acute phase of care, but I think that she will heal well. Lastly, for the patho discussion of the snake bite, the parts of this is one, how the venom is affecting the patient, and then two, the inflammatory cascade that comes from that. The injection of the venom itself is going to have effects both locally and systemically. Locally being that it's causing an abrasion to the skin, and so we're going to have edema and redness, possible necrosis around the site of the snake bite. And then since the venom is being injected into the bloodstream, into the lymph, we're going to see possible hypotension because of how permeable the vessels are becoming from the hemolysis and the cytokines. Also possible neurotoxicity, rhabdomyolysis, and shock, again, from how permeable the vessels are becoming may occur. The hemotoxins that are released with the venom are going to increase the vascular permeability, and this is what's going to lead to that increased leakage and bleeding from the vessels. With this, we're having adhesion issues, coagulation issues, and so the blood's actual ability to clot properly is also impaired. With this, hemolysis can occur. This is going to add to the inflammatory cascade because we're already having cytokines released from the inflammation at the site, and then we're having them released from the venom as well, and this is going to happen systemically. And then a huge part of this is the inflammatory cascade. This is happening locally at the site of where the snake bite wound was, and then systemically where the snake venom ran to. So the venom itself releases cytokines, and this is what contributes to part of the inflammatory cascade, and it makes it systemic. But in both places, we have neutrophils and cytokines being released, and the neutrophils and cytokines are calling more of these white blood cells, more of these cytokines and these inflammatory markers to come to the site so that it can ask the body for help to repair the abrasion on the skin, to impair any damage that's happening to the blood vessels. This is what can cause fever and redness at the site and even an increased heartbeat. So the TNFA molecules and neutrophils and cytokines, although they're calling for more help to repair what's been done, they're actually causing more inflammation and hindering the endothelium lining. This is creating even more permeability. It's breaking it down, and so we can have further leakage, further bleeding, and this is where the patient goes into a possibility of shock. So that's why it's so important to treat the wound as fast as possible. We don't want the inflammation to get so bad, and we don't want infection to occur. That's probably one of the more concerning possibilities that can happen, because we don't want everything to spread. We don't want the patient to go septic, and we don't want them to go into shock. So the sooner that we can treat it, and we can get rid of the venom, get rid of the inflammation, treat and clean the site, we can decrease any chances of that happening.